This is a Pecha Kucha on enteral tube feeding and nurse training. We will first discuss what enteral tube feeding is, followed by different administration techniques provided by nurses, which will then be tied into different lean approaches, which should better the quality of care of enteral tube feeding. Enteral tube feeding is when a patient is unable to swallow whole foods and yet still has access to their gastrointestinal tract for digestive purposes. Here you see a patient that has tubes going through their nasogastric or orogastric routes, that's through the nose and the mouth respectively, down into the stomach or small intestines. A patient receiving a nasogastric tube has the tube placed through their nose and down into their stomach or small intestines. This ultimately provides the ability for the patient to receive the nutrition that they require through the enteral tube feeding and yet not lose the ability to use the digestive tract for future use. A nurse providing enteral nutrition feeding does so by the placement of the nutrition item into a syringe and pushing it through an enteral tube. This will provide the means for the patient to receive the nutrition that they require while not being able to chew up, swallow, and ultimately digest the food that will go through their digestive tract. There are many different available enteral nutrition items available on the market today. Most people will recognize Pediasure as pediatric patients are the most prone to being able to use items that are considered enteral nutrition. Also, most people will recognize Carnation Instant Breakfast and the Ensure products that are available on the market today. There are also complications of enteral tube feeding. This is a clot that is formed using enteral tube nutrition. Many items can cause these clots to form, mainly the interactions between drugs and the enteral tube formula or other items that are going through the tube. There are many consequences of receiving a clot in the tube while receiving enteral tube nutrition. Here, the patient on the left has malabsorption from the nutrition that she did not receive while receiving enteral tube nutrition, and the patient on the left is considered dead. These are both consequences of not receiving the nutrients the body requires on a day-to-day basis. A study done in 2005 showed that medication obstruction rate was significantly increased when nurses used 3 or more inappropriate techniques for administering enteral tube feeding. Furthermore, the study showed that techniques varied significantly from rural to urban facilities and from long-term care to ICU nurses. Enteral tube feeding needs to be examined using Six Sigma and Lean methodology in order to discover the most effective methods for delivering nutrition without harming the patient. Six Sigma would help to develop a universal set of guidelines to administer medications through enteral feeding catheters with minimal variation, and this would be particularly useful for those long-term care facilities. Lean is a value chain focused process that concentrates on eliminating non-value added steps within a process. It's not just about cutting the fat, however, as it works toward process improvement as a whole. This usually begins with a look at the individual steps in the process and trying to find the ones that are unnecessary. This can be accomplished through value stream mapping. Value stream mapping is the process of breaking down a process into a simple diagram. Using this tool is useful to understand the process and make it easier to examine whether or not an individual step is needed, or if we can find the few rocks or complications within the process that are causing the problem, we can then create smoother water ahead. The first source of variation is enteral tube size and placement. Small tubes are more comfortable but have a greater likelihood of becoming clotted by medications, while large tubes have less chance of clotting but they are much less comfortable for the patient. An appropriate sized tube needs to be chosen that makes the patient as comfortable as possible but minimizes the chance for clots. The placement of the feeding tube also has a significant impact on how well certain nutrients or drugs are absorbed. Some are better absorbed if they are placed directly in the small intestines, so the tube should bypass the stomach. Other items are better absorbed in the stomach and should be placed directly into it. A second area for variation that can affect quality is the method for crushing pills. This becomes a problem as every individual may apply different amounts of pressure to the particular device or have different standards for how much to crush a particular pill. Using liquid medications whenever possible is a way to reduce this variation. The medication administration timing needs to be considered when patients receiving enteral tube nutrition. Once daily drug dosing and intermittent or bolus feeding are easier for compliance compared to multiple day drug dosing and continuous feeding regimens. This way, the enteral nutrition isn't constantly interrupted. If the feeding tube becomes clotted Intervention should occur immediately. Some methods for unclogging tubes have been more effective than others. Acidic liquids, such as cranberry juice and colas, actually worsen the problem, while pancreatic enzymes have been shown to be particularly effective in restoring tube patency. Caloric intake is another issue to consider. High-calorie diets can create a more dense fluid in the tube, while a low-calorie diet may not provide enough nutrition for the patient. An appropriate amount of calories should be chosen such that the flow rate isn't affected too much and the patient receives an adequate amount of calories. Chances for error can be removed by eliminating the chance for human error. This can be done by using technology. A pump allows for automation of the feeding process, creating an extremely regulated flow rate, and cleans the tube on a regular basis before and after the enteral tube feeding. It will also sound an alarm if something actually goes wrong. Appropriate training can also be the best way to reduce variation and eliminate waste in the process. Training will reduce complications by bringing potential complications to light and thus reduce their occurrence through more routine and scheduled administration of an enteral tube feeding. Through proper care and available technologies, we can eliminate complications within the process altogether to better the quality of care for enteral tube nutrition and patient feeding. This concludes enteral tube nutrition Pecha Kucha.